Assalamu alaikum. This presentation is on the anatomy and physiology of the larynx for junior trainees and undergraduates. This is the first of two presentations on the anatomy and physiology of the larynx. In this first presentation, we shall go through about 80 evidence-based bullets, and in the second presentation, we shall go through about 40 questions, false or true or MCQ, in order to consolidate the knowledge. The pharynx is a common pathway for food passing into the esophagus and air passing into the lungs. The larynx separates this common pathway, the pharynx, from the exclusive airway into the lungs by being situated on the top of the exclusive airway where only air is allowed entry. The larynx is an airway valve. It is dynamic because it can open up by vocal fold abduction to allow the air into the lungs and can maintain the patency of the airway even during deep inspiration by having stiff walls enforced by cartilages. When the vocal folds are adducted, the larynx is now an inlet valve that prevents food from escaping into the airway and also prevents the rapid escape of the air from the lungs to the outside. The inlet airway valve is the primary function of the larynx. This is the most important function of the larynx. The vocal folds would be adducted towards the midline and close up the glottis and the larynx to prevent any food from escaping during swallowing into the airway. This is the primary function of the larynx. And the larynx can also act like an exit airway valve that prevents the rapid escape of the air from the lungs into the pharynx. But this is the secondary function of the larynx. It is used during thoracic fixation. Adducting the vocal folds will prevent the rapid escape of the air from the lungs when there is a need to increase the pressure, the abdominal pressure, during, for example, defecation or during labor or during the initial stage of coughing. Also, the control of the airflow from the lungs to the pharynx is required during voicing. During voice production, the larynx would adjust the expiratory airway flow and control this. This is the secondary function of the larynx, the exit airway valve. The larynx as an airway valve is not only dynamic, as it can open up by the abduction of the vocal folds and closes down by the adduction of the vocal folds, but it's also adjustable under neuromuscular control so that these functions can be adjusted. For example, during voice production, the amount of air escaping from the lungs through the larynx can be adjusted by changing the position of the larynx in the neck, up and down the neck, or by changing the vocal fold dimensions by acting on the laryngeal muscles, or change the vocal fold stiffness and tension again through the action of the laryngeal muscle to adjust the amount of air escaping and produce the required voice. The functions of the larynx as a valve can be controlled by changing its position up and down the neck. By elevating the larynx and the neck, the function of the larynx as an inlet valve during swallowing is improved. This would allow the larynx to prevent aspiration better. The same is also required, elevating the larynx and the neck during the production of high-frequency voice. On the other hand, changing the position of the larynx downwards and the neck is required during the production of low-pitch voice and also during deep breathing when more air is allowed through the laryngeal inlet. Elevating or depressing the larynx and the neck is controlled mainly by muscles attached to the thyroid and the hyoid bone. All the muscles attached to the hyoid bone and the thyroid cartilage and moves upwards towards the mandible or the skull base would elevate the larynx, like the digastric muscles, the myelohyoid and stylohyoid, for example. On the other hand, the muscles attached to the sternum that are attached to the thyroid and the hyoid would depress the larynx and the neck. Not only the larynx moves up and down the neck, it can also tilt forward, for example, during swallowing, because that would also improves its function as an inlet valve. Shall go through the basic anatomy of the larynx, formed up of 3 laryngeal compartments, 6 laryngeal cartilages, some suspensory ligaments, 5 laryngeal muscles, 2 laryngeal joints, 2 laryngeal nerves, and 2 arteries and veins, and also the lymphatic drainage. The level of the vocal folds divides the larynx into 3 compartments. The middle compartment is formed by the vocal folds, the anterior commissure where the vocal folds meet and insert into the thyroid cartilage, and the posterior commissure, which is the distance between the posterior parts of the vocal folds formed by the arytenoid cartilages. Anything above the glottis level is called the supraglottis, and anything below this is the subglottis. The supraglottis is formed by the epiglottis itself, the fold between the epiglottis and the arytenoid, the aryepiglottic fold, the ventricular folds, sometimes called the false vocal folds, and the space between the ventricular folds and the vocal folds, which is the laryngeal ventricles. You can see this more clearly on the coronal section of the larynx, where this triangular folds are the vocal folds, and between the vocal folds and the ventricular folds here is a small recess, the laryngeal ventricle. Below the vocal folds is the subglottic space formed in the area protected by the cricoid cartilage, and above the level of the vocal folds is the supraglottis formed by the ventricular folds, the epiglottis, the aryepiglottic folds, and the laryngeal ventricles. There are 6 laryngeal cartilages. 3 of them are single and the other 3 are paired. The single cartilages include the cricoid, which is a complete cartilaginous ring that is attached to the first tracheal ring. On top of the cricoid sits the arytenoid cartilages posteriorly. We'll come to this in the paired cartilages. The other single cartilage is the thyroid cartilage, which is Adam's apple. This is the largest cartilage of the larynx. In the prominence of the thyroid cartilage towards the midpoint is inserted the vocal folds, and just above the insertion of the vocal folds internally here, the epiglottis is also inserted in the inside of the thyroid prominence. The third single cartilage is the epiglottis, which is a sheet of elastic cartilage that is attached to the thyroid cartilage and acts like a lid that covers the inlet of the larynx during swallowing. The paired cartilages are basically the arytenoids, which are pyramidal shaped cartilages that sits on top of the posterior part of the cricoid cartilage and gives attachment to the vocal folds, and when these arytenoids move, the vocal folds open and closes up. On top of the arytenoid cartilages are two tiny cartilages, the corniculate, which is nearer to the apex of the arytenoid, and the cuneiform cartilage. Both these cartilages are part of the aryepiglottic fold, and they stiffen the aryepiglottic folds. There are 5 major laryngeal muscles. 4 of them are internal and only one, the cricothyroid, is external to the laryngeal cartilages. The laryngeal muscles moves up the vocal folds to open during breathing and closes during phonation and during swallowing. All the laryngeal muscles are innervated by the recurrent laryngeal nerve except the external muscle, the cricothyroid muscle, which is innervated by the external branch of the superior laryngeal nerve. There are 5 major laryngeal muscles that moves the laryngeal cartilages to open up the vocal folds by abduction of the vocal folds and closes the vocal folds by adduction of the vocal folds, and also changes the dimensions of the vocal folds and its tension. This is a transverse section in the larynx showing the arytenoid cartilage with 2 processes. One of them, the medial, is the vocal process to which is attached the vocal fold. The vocal process itself forms the posterior part of the vocal folds. The other process is the muscular process, to which is attached the laryngeal muscles that moves the vocal folds. If the muscle is attached to the posterior part of the muscular process and pulls it posteriorly, this would move the vocal process laterally, and this would open up the vocal fold. On the other hand, muscles attached to the anterior part of the muscular process would rotate the arytenoid cartilage medially and closes the vocal fold. There is only one muscle that can open up the vocal folds. This is the posterior cricoarytenoid muscle, which is attached to the posterior part of the muscular process, and when it is pulled, it opens up the vocal fold during breathing. On the other hand, adducting the vocal folds can be achieved by 3 muscles: the lateral cricoarytenoid attached to the anterior part of the muscular process, the thyroarytenoid, which forms the bulk of the vocal fold, and a small muscle in between the posterior part of the arytenoids that also closes the posterior part of the vocal fold during, for example, phonation or swallowing. The vocal folds can be tensed, lengthened by the cricothyroid muscle, which is an external laryngeal muscle that approximates the cricoid and the thyroid cartilage, and by doing this, it displaces the cricoid cartilage a little bit more posteriorly, stretching the vocal folds and increasing its tension. The other muscle that can also tense the vocal fold is the thyroarytenoides that forms the bulk of the vocal fold. Larynx is supplied by 2 nerves: the recurrent laryngeal nerve, which innervates all the muscles of the larynx except the cricothyroid, and also gives sensation to the vocal folds and everything below the vocal folds, the glottis and the subglottic space. The other nerve is the superior laryngeal nerve, which has 2 branches. The external branch of the superior laryngeal nerve is called the external laryngeal branch, and this moves the cricothyroid muscle, and the internal branch of the superior laryngeal nerve, which gives sensation above the level of the vocal folds. The larynx has two major joints, the cricothyroid joint between the cricoid cartilage and the thyroid cartilage. This joint is moved by the action of the cricothyroid muscle. When it contracts, it displaces the cricoid cartilage upwards and posteriorly relative to the thyroid cartilage. On doing this, it displaces the arytenoid cartilages, which sits on top of the cricoid backwards. This stretches the vocal fold and increases its tension. The other joint is the cricoarytenoid joint between the arytenoid cartilages and the cricoid posterior part. This arytenoid cartilage has two processes, the muscular and the vocal, and when the muscular process is pulled anteriorly, the vocal process of the arytenoid would rotate medially, and the exact opposite would happen if the muscular process is pulled posteriorly. The vocal process would move laterally and open up the glottis. There are two sets of blood vessels for the larynx. The supraglottis is supplied by the superior laryngeal vessels, one single artery and several small veins. These are branches from the superior thyroid artery and veins and supply the supraglottis above the level of the vocal folds. The other set is formed by the inferior laryngeal vessels, again a single artery and several small veins, branches from the inferior thyroid vessels and supply the vocal folds and the subglottic space. The lymphatic drainage for the three compartments are also varied. There are very little lymphatics in the vocal fold itself. That's why tumors and the vocal folds don't send metastasis early to the neck nodes. The supraglottis, on the other hand, is supplied by rich lymphatics and drains into the upper deep cervical lymph nodes. The subglottic space is also rich in lymphatics and drains to the lower deep cervical lymph nodes. As explained earlier, the laryngeal functions are airway protection, voice production, and thoracic fixation. Airway protection is the primary function of the larynx to prevent aspiration. You could see here the dye being swallowed, and it's meant to pass through the pharynx into the esophagus without any spillage into the larynx. There is a small amount of spillage you can see here. Some of the dye is going the way of the larynx. This is usually prevented by a very rich laryngeal sensation that senses the passage of food into the larynx and triggers reflexes in the form of glottis closure by adduction of the vocal folds, and also laryngeal elevation, which can prevent or decrease the amount of aspiration, and a cough reflex. If any material passes below the vocal folds, they will be coughed up by the cough reflex. To explain how the larynx produces the voice, the vocal folds would be adducted. They close up the glottis and control the escape of air from the lungs and the subglottis through the larynx into the pharynx and the mouth and occasionally the nose. Because they are closed and adducted, pressure is going to build up in the subglottic area, and once this pressure increases to a certain amount, they will push apart the vocal folds and a small amount of air would escape into the pharynx like a puff of air. Once this happens, the elastic vocal folds would close up again because the pressure has now dropped, and as another cycle is going to form because the pressure would build up again, and again it would reach a certain amount of pressure, push up the vocal folds open, small amount of air would escape, and another cycle. This cycle will be repeated very quickly, more than 400 times in a child, maybe 200 to 300 times in a second for a female, and maybe 100 times in a second, like a hertz, in a male. By doing this, they change the flow of air, the aerodynamic energy, into acoustic energy. This is the voice, the sound produced by the vibration of the vocal folds. This sound is then resonates in the pharynx and the mouth, and occasionally in the nose to produce the speech. The rate of the vocal folds vibrations during voice production can be controlled and adjusted to produce the required frequency and intensity of the voice. The frequency of the vibrations is the frequency of the voice produced, number of cycles per second. This adjusting the elasticity of the vocal folds layers can adjust the frequency and the volume of the voice produced. The vocal fold itself is not a single structure. It's formed of 5 different layers. From very superficial, the first layer is the epithelial, squamous epithelium cover of the vocal folds, followed by a layer of very loose connective tissue, an intermediate layer of the lamina propria of the ligament, which has some elasticity, and then a deeper layer of the lamina propria, which has elasticity but also has stiffness in collagen fibers. And the final layer, the most deep, is a muscular layer formed by the thyroarytenoid muscle. This very fine design allows modulating and adjusting the elasticity of the vocal folds to produce exactly the required frequency and intensity of the voice. Yes, we come to the end on this presentation on the anatomy and the physiology of the larynx. The following presentation would have the false and true and the MCQ questions on the same subject, the anatomy and the physiology of the larynx. Assalamu alaikum.